Welcome to Mom and Mind, a podcast about maternal mental health from conception to pregnancy and postpartum. Real stories from moms and family members who have made it from struggling to wellness, and interviews with experts and advocates who work for moms and families to get the help they need. We discuss very real struggles that can sometimes be hard to hear, but these are stories that need to be told so that moms and families can know that healing is possible. This podcast is meant to offer information and awareness and is not a replacement for treatment by a professional. Thank you for being with us today. Welcome to Mom and Mind. I'm your host, Dr. Kat. On this episode, we're talking with Parijat Deshpande, who helps women through high-risk pregnancy. We will discuss what the high-risk designation is and some of the associated factors, implications for mental health, and we'll talk about how to cope with the stress that can potentially come during these difficult pregnancies. Parijat is a leading perinatal wellness expert who specializes in working with women during high-risk pregnancy. She educates and guides women on how to manage their stress and anxiety so they can have healthier pregnancies, decrease their risk of preterm birth, and give their baby a healthy start to life. Parijat is a clinically trained therapist, a women's wellness expert, and an experienced speaker on the impact of stress on health and wellness. She has over 4 years' experience as a psychology lecturer at UC Berkeley and is a founder of MySahana, a South Asian mental health nonprofit. Parijat is also a certified wellness coach, certified stress management coach, and a certified marriage educator. Thank you so much for being here. I'm really excited that you're on with us.
Thanks so much for having me. I'm excited to be here too.
Yeah. So we're going to have you on for a couple of episodes to talk about some different things that happen during the high-risk pregnancy period and how to help moms cope. This is the work that you do. You have a lot of information and wisdom to share with the listeners. But I'd like to get started by asking you about you and the work that you do and how you got to be in this specialty.
Yeah, absolutely. So as you mentioned, I'm a clinically trained therapist and I was doing child and family therapy for a little while and I was teaching up at UC Berkeley and just kind of doing my thing. And then I got pregnant and I had a very, very high risk pregnancy. I had actually 8 different complications during my entire pregnancy. And I landed on bed rest when I was 6 weeks along. And my doctor said to me, you have to stop working. If you want to do everything you can to save this pregnancy, you got to go on bed rest. You have to just stop working. So everything stopped months before I was ready to actually do it.
Yeah.
And so that transition to bed rest and this new world, this new life was really, really hard. And then on top of that, the uncertainties and all the ups and downs, and then being thrown into this whole medicalized pregnancy experience. And it was a really difficult, really hard time. And I remember thinking, well, hey, I'm a therapist, so I should have access to some kind of support somewhere. There must be somebody somewhere doing this.
Right.
I looked and I looked and I looked and I couldn't find anyone.
Yikes.
And so with everything that we struggled with over the 24 weeks and 5 days that I was pregnant, it was such an awful time. And then I realized that actually therapy wouldn't have been helpful anyway, because what I was going through and what women who go through this go through is a crisis. Every single second of every day, they're going through a trauma.
Yeah.
And so towards the end of my pregnancy, I remember I was in the hospital and I didn't know it was the end of my pregnancy so soon, but I remember thinking, if we survive this and we get to go home, I have to change my career because I can't stand the fact that there are so many women going through this without the proper type of support. And so that is where this work comes from, is purely from this personal passion of knowing that there's a huge need for women who are struggling during pregnancy. And that's why I'm here doing what I do.
Right. And, I haven't found anybody else who's doing such highly specialized work and in the way that you do it. For people who don't know, the therapists are kind of limited to the state that they live or work in, and with some exceptions. And so that can be really limiting. But you are now a coach also, which allows you to work across state lines.
Exactly. And the work that I do then is so much more action-oriented, very practical support. It includes patient advocacy and supporting women to be their best advocate for themselves and their baby. So much of that, which I wouldn't have been able to do as had I continued my therapy practice.
Right. So, wow, you bring a lot of your own personal experience and passion into this. And so, yeah, maybe we can, towards the end, I can find out a little bit more about how you help moms to get through this stuff. But before that, I think it would be good for the listeners to understand a little bit about what is a high-risk pregnancy? What does that mean? What does it include? If you can give an overview.
Sure. Yeah. It's a really broad general term to begin with. So I'll definitely say that. But a high-risk pregnancy basically means that you are at risk for developing health complications during your pregnancy. So that actually it includes women who have health complications or any kind of medical diagnoses prior to pregnancy, some kind of pre-existing condition, or that you develop a health complication during pregnancy, or your baby develops a health complication during pregnancy. So it encapsulates all of that. There's several risk factors for developing high-risk pregnancies. I know when I talk about that, sometimes women go, well, am I going to have one? How do I know? And so there are several, there's quite a few actually, but the main ones are a term you might have heard called advanced maternal age. It's usually qualified as about 35 years of age for mom. It's a terrible term. I'm not a fan of it at all, but they're basically saying after the age of about 35, you're more at risk for developing complications. So you're automatically considered high risk once you get pregnant. As I mentioned earlier, if you have a pre-existing medical condition like autoimmune diseases, high blood pressure, epilepsy, asthma, even mental health issues, especially if there's severe mental illness, they are considered as high-risk conditions too. Any health conditions that you develop during pregnancy, like bleeding, shortening of the cervix, gestational diabetes, preeclampsia, things like that. As I mentioned earlier, sometimes a high-risk pregnancy isn't about mom, but sometimes it's because of a medical issue with baby, including poor growth, genetic abnormalities, things like that. And I will definitely make it a point to say here that high stress and anxiety are also risk factors for developing a high-risk pregnancy. And that's whether you are stressed or anxious even prior to pregnancy or even during pregnancy, it can actually create and cause complications even in an otherwise healthy pregnancy, which is a lot of the work that I do. And then women who are carrying multiples, so twins, triplets, or higher, are automatically considered high risk as well.
Right. So that makes sense. Yeah, I'm interested in understanding a little bit more about the mental health aspects and how that can lead to a high-risk pregnancy for the health of the mom and the health of the baby.
Yeah. So typically a lot of perinatologists, especially ones who are really good about understanding the connection between mental health and physical health, will qualify moms as high risk if they have severe mental illness. You know, we're talking psychosis, schizophrenia, severe bipolar disorder, severe depression, things like that. And that's because moms who have that may be at risk for having these symptoms exacerbated during pregnancy. Medications need to be monitored a little bit more closely. The medications may have side effects to mom or baby during pregnancy. And so for a lot of those reasons, they want to just keep an extra eye on both mom and baby during a pregnancy, even if there are no other medical complications going on. But with stress and anxiety specifically, there's so much research that's coming out about how it directly impacts your body as mom, and then how that translates into baby's growth and development. Things like impacting blood flow to the baby, impacting placenta growth, impacting baby's growth even. And one of the biggest risk factors that stress creates is for preterm contractions. And a lot of the moms that I work with are so surprised to see that when they work with me and they are able to lower their stress effectively, that their contractions actually go away. And so there's such a strong connection between stress, anxiety, and how it presents in your pregnancy. And if you already have a high-risk pregnancy with other complications, it's just that much more important. It's really critical that you manage your stress and anxiety so you don't add on to the risk factors.
Wow. Okay. So, right. That's super important. I guess what it brings up for me is I'm trying to think of, like, putting myself in the shoes of a mom who has a high risk designation and who is feeling stressed or depressed or anxious about the amount of like worry or guilt or, responsibility that comes with taking care of themselves in a different way while pregnant.
Absolutely.
Yeah.
Absolutely. It's such a chicken and egg almost situation of where did the stress come from, and and the complications. I mean, the complications cause anxiety, of course, because your pregnancy isn't going as smoothly as you'd hoped for.
Right.
But then the stress can cause more complications. And so it's just this loop that you get stuck in, which is why it's so important for moms to not only get really, really good prenatal care and care that you trust from a doctor who you really, really look up to as somebody giving you the right information. And I say that because not all women are happy with their prenatal care. And so this is kind of my message to say, if you're not happy with it, keep looking. So it's really important that you get really good, solid prenatal care and that you manage your emotions and your overall wellness at the same time. Both of them are equally important. It's not one or the other.
Mental health and physical health.
Yeah.
Right. So I think that's a really good point too about finding care that feels right for you or that feels more supportive. It seems like, there can be a little bit of a power dynamic. Maybe, we go into a doctor's office, we're in this high risk designation or, and maybe feeling more vulnerable from that. And then, potentially thinking like, okay, well, this doctor is supposed to know what they're doing and, maybe I should just follow along. So what do you say to those moms to help them, empower them to get the other help?
What I say to them is you are your baby's best advocate. Your baby cannot speak right now, won't be able to speak for a long time. You are your baby's best advocate. And if you don't speak up, you will not get the appropriate care that you and your baby need during your pregnancy. Mm-hmm. So, whatever that white coat syndrome is that we're facing, or those fears, or that hierarchy that we feel in the room, if you feel that with your doctor, you need to find another doctor. Mm-hmm. This is not the time to spend trying to tiptoe around somebody, trying to figure out whether it's okay to ask a question or not. Now is the time to ask everything that comes to mind, to push back if something doesn't feel right, to get a second opinion, because that's where a lot of the anxiety comes from, is not understanding what's happening to your body.
Sure.
Complication on top of that, it's scary, right? You're scared for your baby. Of course you are. So what you need is to make sure you have a trusted doctor that's on your team who understands that you are the expert on your body, and they're going to guide you from a medical perspective on what you can do to take care of you and your baby during your pregnancy.
Right. So, I mean, I imagine that the word high risk for a mom to hear can be somewhat alarming, to be, sort of put in this category. Is it always an alarming thing, or,
It's not. No. I mean, sometimes, like we talked about earlier, sometimes the high risk designation is just to flag you as you have more chance than the average woman of having complications. That doesn't necessarily mean that you will. You may go on to have a perfectly smooth, healthy pregnancy, deliver at term, and have a healthy baby to take home. Mm-hmm. That's absolutely possible.
Okay. So high risk doesn't mean like potentially bad outcome.
Right, exactly.
The doctors what comes with high risk are people being seen more frequently, being checked more often?
Yeah, you will likely see a high-risk pregnancy OBGYN, also known as a perinatologist or a maternal fetal medicine specialist. Mm-hmm. And then you'll have more frequent monitoring. You'll have more ultrasounds, more, especially as you get closer to your due date, you'll have more appointments with your doctor just to make sure that you're doing okay and that baby's growing properly.
Okay. So in terms of the mental health of moms, what do you see, a lot of the moms struggling with in terms of their mental health? You mentioned depression and anxiety. Can you speak a little bit more to the mental health stuff?
Yeah, absolutely. So there's a lot of risk factors and a lot of things at play that can really mess with your mood or can really exacerbate that anxiety. You know, there's a lot of uncertainty, especially if you're not from the medical field. There's all these new words that are being thrown at you. You don't know what's happening. You don't know what it means. And your doctor can't tell you what to expect. That, I think, was one of the most frustrating things about having a high-risk pregnancy is you don't know how it's going to turn out. And that's scary. And so those that uncertainty, and then you add on to that potential guilt. You feel like you might be failing your baby, that you're not doing something that you should be able to do by taking care of your baby. You feel extra stress about finances if you're not able to continue working, or how to take care of your other children. So there's a lot of really intense, conflicting emotions. You know, you want to be happy, but you're not sure if it's safe to be happy, and you don't want to jinx anything. And then you add on top of that, women who are on bed rest are very, very isolated. And so they're physically isolated from their world. They don't feel like a lot of people in their lives can understand what they're going through. And so you turn into this little tiny bubble, and that just kind of feeds itself. The anxiety can get higher, the depression can get lower. And it just, it's a really difficult time emotionally, especially when you don't know who to turn to for support.
Wow. Yeah. And we're kind of asking moms to sort of figure it out without having any support on how to figure it out specifically.
Right.
Wow. Right. So I think in our next talk, I'd like to really get deep into and understand more about bed rest and what that all means. But I think from what you're saying, like, as you said before, high risk doesn't also necessarily mean bed rest. It won't necessarily end up having to have that level of care and monitoring.
Exactly.
There's a lot of other stuff going on, you know, mentally, just, it is a lot to consider trying to manage, just with coping and figuring out ways to, I don't know, you probably have to like rearrange your life on some level in order to manage if it is a serious high risk.
Yeah, absolutely. You, on one end, you know, the only effect you might see is you just have to see a doctor more frequently than you had expected. And on the other end, your entire life may stop completely. And the only thing you're doing is everything you can to stay pregnant, and everything else stops. And so this is on a continuum. So you can be anywhere on that continuum. And that's why it's so important that you stay informed about what your pregnancy complications are and what your doctor's recommending and why they're recommending it. So you make sure that you're taking all the right precautions and nothing is falling through the cracks.
Okay, so in terms of the work that you're doing with moms, what are the most common things that you're helping them, and what are some ways to manage and cope with all of this? What do you do?
Yeah, so I work with women. They typically find me usually in the second trimester. That's when most women who have a high-risk pregnancy end up developing complications. That's not always true, but that's when the women who I work with end up finding me, is typically in the second trimester. And I help them on a variety of different ways. One end of it is a patient advocacy piece, so really teaching moms and educating and empowering them on the importance of speaking up, how to trust your body, ways to ask questions so you get answers from your doctor, so you're not walking out of the waiting room, the exam room, looking at Google for answers that your doctor should have been able to give.
Oh, gee. Yeah.
And then on the other side of it is really showing them all the different ways that they can improve the health of their pregnancy. You know, we talk about overall wellness. So stress and anxiety are a huge part of it. There's also making sure you're sleeping properly, making sure you're eating properly. How do you get the benefits of exercise when you can't exercise or you can't even stand up? You know, so finding different ways to get the benefits from your overall wellness plan that you used to have, that used to work so great for you, adapting that to now your new reality until your baby comes home. And then a lot of it is really reminding them and empowering them that all these positive steps that they take are impacting their baby in a really good way. Your baby can feel it when you're happy, when you're relaxed, when you are at peace. And so you're not just doing it for you, you're doing it for your baby too.
Okay. So, you know, there aren't enough people doing what you do. In terms of numbers, I mean, how many moms are we talking about that are potentially dealing with these really more serious pregnancies?
I read somewhere that there's a really large number of women who are on bed rest every year, and the number is escaping me right now. I can email you that number if you'd like and just delete that part of it. But for high-risk pregnancies, there's something around 10 to 15% of women have high-risk pregnancies, and I would say that number is rising because women are getting pregnant later in life. Women are, more women are getting pregnant after fertility treatment, and that the underlying causes of infertility can be a risk factor for complications. So we're talking at least 600,000 women a year who are dealing with something like this. So it's a pretty large group of women who are going through it and without the proper support.
Okay. That's a lot of women. And so, I mean, you alone can't help every single person. But what are some things that, for people, providers who are listening, who are seeing these moms in either in therapy practice or OBs or pediatricians who, are seeing moms who are, have little kids or still pregnant? What are things that providers can consider when talking to these moms about, what's going on for them?
I think the first thing is to consistently check in with her and see how she's doing, and encourage her to be really honest with herself. And if she's not comfortable being honest with you, ask her to be honest with somebody else about how stressed and anxious she really is. We tend to underestimate frequently how stressed we are, thinking, oh, we're fine. I'm okay. I can do it. I can get through this.
Yeah.
And this is not the time to do that because it's impacting your baby. When you say things like that, you're not getting the proper support for you or your baby. So checking in with her frequently, how she's doing, ask her, how she's coping, ask her what she needs. I would also say to encourage, especially for loved ones, to visit her frequently and talk to her about things outside of her pregnancy. Really encourage her to remember that there is a world outside of this, because she needs that reprieve too. She doesn't, as much as she feels compelled to be focused on the pregnancy 24/7, she also does want a break. And so talking to girlfriends or setting up a movie night or something, that whatever it is that she can still do is so good for her, and then ultimately really good for her baby.
Right.
The last thing I would say is to regularly remind her that not everything is just typical for pregnancy. It can be related to hormones, absolutely. Things like not sleeping well, you can be uncomfortable, but it could also be signs of anxiety or stress or depression, and that she can do something about that. She's not helpless against it. And to get involved in her care can really take away that helplessness and help her feel back in control.
That's amazing. Yeah. I mean, that makes perfect sense. But, maybe I imagine that it's hard though for moms who are maybe overwhelmed by the ideas and thoughts of their baby being at risk or them being at risk to be able to remember all of this stuff. So that's potentially where you come in too, is to help give a plan moving forward. Is that part of the work that you do?
Exactly. We work together to create a plan, and then I walk you through it. So you're not going through it alone. You don't have to remember all these details. You don't have to be, in 15 different places emotionally, mentally, physically at one time. That I can hold that for you.
Right.
So that we're always saying, okay, what do we do now? What do we do now? And there's always, that there's always somebody in your corner or in your back pocket that's looking at your pregnancy from your perspective, going, what's going to be best for you and your baby, not just physically, but emotionally and just realistically, what does this look like in the real world?
That's so good. The work that you're doing is awesome and amazing. It's part of the reason why I wanted to have you on here, because really, I don't see enough people, but enough people doing this. And this is happening to so many moms, and I'm sure just like, other types of depression or anxiety, moms are already feeling isolated and alone, but then also having this extra layer or layers of things to be concerned and worried about.
Right.
Like mental health is paramount to be
absolutely
to being attended to.
Absolutely.
So you've seen moms with, be able to get through this and heal and recover and be okay.
Yeah, I have.
And in the work that you're doing with your moms, are you working with them kind of all the way through, or is it kind of up to them, or do you guys figure that out together?
Yeah, we figure it out together. So when they first call me, I do a consultation to get a sense of what they're struggling with.
Mm-hmm.
And we work on getting them the support that they need, that they can really benefit from during their pregnancy. And then I do have a postpartum program specifically for women who've gone through a high-risk pregnancy or a traumatic delivery, because I really strongly believe that recovering and healing from that is so different than any other type of delivery or pregnancy experience.
Yeah.
So I do have that for them if they want to continue once baby is born.
Okay, so that's another episode. I need to have you on to talk about that too. I mean, these are great resources, for people who are in this world of maternal mental health. Maybe they're more plugged in and they can figure out where to find some of these resources. But the average person, it doesn't have this like on the tip of their fingertips to know that this resource is available and that there is support that they can have, and they can ask for help to get through this period of time in terms of their mental wellness.
Exactly.
Okay, so essentially there's a lot to consider. High-risk pregnancies on a spectrum. Some moms will be totally fine. Pregnancies will be totally fine, and other moms may have more serious things to consider, and maybe impacting their mental health in a more significant way. But all of those moms can benefit from help. There are ways to cope through this. I'm just, I'm trying to really understand, and hopefully the listeners can understand, is that there's a roadmap here on some level that you can figure out with people to get through these difficult things, manage their emotional mental health, reduce their guilt or their shame or their worries, and be able to be present for the pregnancy that they have.
Right, exactly. And all of that is to improve the health of your pregnancy and give your baby a healthy start to life. As we talked about earlier, physical health is not the only type of health, and you have to be able to manage all of it. And doing it alone can be really hard. And that's why I'm here, is to help you through it.
Thank you so much. This is such good information and education about high-risk pregnancy, and I'm really excited to have you back to talk about bed rest, and so we can understand that a little more deeply, and also give moms some ideas about how to cope with that. Parijat can be found on Facebook, on Twitter, on Instagram, and on LinkedIn. And for those of you who are listening, she has a lot of awesome resources and good stuff on her website. And we will talk with you again. Thank you so much, Parijat.
Thanks so much for having me.
By joining us today and listening, you're a part of the growing community of people who are aware and concerned for mothers and families during this beautiful and sometimes very difficult time of life. Please take a moment to subscribe, rate, and review this free podcast so that Mom and Mind can be found by moms, families, and providers who will benefit from hearing our talks. If you or someone you know is having a hard time, help is available. Please look for resources for help at momandmind.com, where you will also find links and information from today's episode. Thank you for listening and being a part of the Mom and Mind community.